Here is some information and advice to help with your bowel management. First, it is helpful to understand what is normal bowel function. It is normal to open your bowels from between 3 times a day to 3 times a week. Normal function should mean you have an awareness of the need to open your bowels, you are able to hold on to go to the toilet at an appropriate place and time, you can empty your bowels fully without straining when you sit on the toilet. The consistency of the stool can vary considerably, and this depends on many factors, including diet, hydration, stress, anxiety, illness, or a change in your routine. Ideally, the stool should be a soft, smooth, sausage shape, which is easy to pass. It is important to avoid looser stools and constipation, as this will impact your ability to hold on till an appropriate time and your ability to empty your bowels fully. Common disorders of the bowel include the following: constipation. This is when the bowel movement is infrequent, hard, and difficult to pass. Obstructed defecation is when you are unable to evacuate the contents of your bowels, even with excessive straining. Fecal incontinence is the leakage of gas, solid, or liquid from the back passage. Fecal urge incontinence happens when you are not able to get to a toilet quickly enough, when you get the feeling of needing to go. Passive fecal incontinence is when you are unaware of leakage of wind or stool from your back passage. Stress fecal incontinence is when you leak stool from the bowel when your abdominal pressure increases with activity, for example, coughing, sneezing, exercising, and lifting. The muscles that control bowel leakage include the pelvic floor and anal sphincters. The pelvic floor muscles are a hammock of muscles underneath your pelvis. They attach at the front of the pelvis to the pubic bone and span backwards and attach at the base of the spine around the sacrum and coccyx. The opening of the bladder, vagina, and the bowel all pass through the pelvic floor. The back passage, or anal passage, has 2 rings of muscles that wrap around to form the anus. These muscles are the internal sphincter, which is the inner ring. This is an involuntary muscle, which should be closed at all times, except when you are actually trying to open your bowels. This muscle works automatically and is not something you need to think about contracting. The external sphincter, which is the outer ring, this muscle is a voluntary muscle, which means you are able to tighten it and close it more firmly if you have urgency, wind, or diarrhea. Either or both of these sphincter muscles can become weak. There may be no obvious reason, but it is often due to childbirth, trauma, constipation, and excessive straining or general age-related changes. If you have weak muscles, you may leak gas, liquid, or solid stools. When you pass a stool, there is usually some residue of the stool left behind in the anal canal. After opening your bowels, the back passage normally snaps shut via the sphincter muscles, and in doing so squeezes out any residue. You can then wipe clean and there should be no further leakage. If the muscles are damaged or weak, they may not close immediately or completely after you have been to the toilet. You may then find it difficult to wipe clean, and you may find that you leak for a while after opening your bowels. The amount and time this may happen can vary. You may also find that you leak with exertion or when you pass wind. We cannot strengthen the internal sphincter, as this is an involuntary muscle. We can, however, strengthen the external sphincter. Doing regular exercises can help increase the anal muscle tone, which may compress the internal sphincter and help to improve wind control and prevent leakage. The first exercise, the external sphincter, lie or sit comfortably with your knees slightly apart. Clench your anal sphincter as if you are trying to wink your anus, or imagine that you are trying to use your anus to pick up a marble from the chair. The second exercise, deep pelvic floor muscles. A pelvic floor muscle contraction is performed by closing and drawing up your back and front passage. Squeeze deep inside the back passage. Imagine you are trying to stop or delay an urgent bowel movement or wind, and at the same time try to stop your flow of urine by clenching and drawing up vaginally. The feeling is one of squeeze and lift. In the beginning, it may be easier to do the exercises in lying, but you can progress to do them in sitting and standing and walking. For both of these muscles, there are 2 types of exercises you should do. Quick and strong. Squeeze as hard as you can and then relax. Rest a second and then repeat up to 10 times. Endurance. Squeeze and hold the contraction for up to 10 seconds. You must feel the muscle relax after each squeeze. Aim to repeat it as many times as you can, building up to a maximum of 10 times. Do not pull in your stomach excessively. Do not squeeze your legs together. Do not tighten your buttocks. Do not hold your breath. You must aim to do these exercises at least 3 times a day. Generally, it takes 3 to 6 months to get a muscle really strong again. Do not do so many that the muscle begins to ache. Remember, it is quality, not quantity. The way you empty your bowels is important for those who have difficulty passing a movement and for those with leakage. A good routine will encourage better bowel function long term. How to pass a bowel movement. Work with your body and only go when you have an urge. Position yourself comfortably on the toilet using a good emptying position. Use a footstool to get your knees higher than your hips. Lean forward to replicate a squat position. Support your hands on your knees. Relax and lower your shoulders. Keep your lower back straight. Relax. Breathe slowly and gently. Try to let go with all of your muscles. Now try to open your bowels or bladder. Remember not to hold your breath. Slowly brace outwards. Widen your waist and bulge your tummy. Making an ooh sound can help. When fully braced, push or propel from your waist back and downwards into your back passage at an angle, pushing from the diaphragm down and flaring the ribs to increase the abdominal pressure. Making a moo sound can help. Do not strain. Relax for 1 second, but only very slightly. You must maintain a level of pressure with your brace whilst not pushing with it. Brace outwards and push downwards again. This should be repeated. Use your brace as a pump. Bulge and brace. Push down and back. Remember, this takes time and practice. If you are struggling to empty, try rubbing the area above your coccyx or rocking backwards and forwards. Even standing up and jiggling on the spot before sitting down to try and empty again. You can also use your hand to support the area between your vagina and back passage, preventing descent and enabling a better emptying. After emptying your bowels, tighten your anal sphincter with 5 to 10 quick squeezes of your pelvic floor muscles before wiping your bottom. If there is no bowel movement after 3 attempts, do not continue to strain, leave the toilet and return later when the urge comes back again. Good bowel management advice. Hydrate well. Drink 1.5 to 2 litres of fluid a day. Eat a healthy, colourful, balanced diet. Improve dietary fibre from fruit and veg to help your bowel work effectively. Open your bowels when you get the urge. Try to avoid putting off going for a poo too often. Support your perineum with your hand if necessary to help you empty. Do not strain. Finish your passage of stool with quick clenches of your pelvic floor and anal sphincter muscles and end the movement. Do regular pelvic floor muscle and sphincter exercises to maintain good function. Certain bowel problems require immediate attention to rule out any significant pathology. You should see your GP if you have any of the following symptoms: bleeding from your bottom or blood in your poo without any obvious reason, such as local soreness, piles or a tear. Any change in bowel habit that lasts for 3 weeks or more, especially if you are going to the toilet more often or experiencing unexplained looser stools or ribbon-like stools. Any constant, unexplained pain in the abdomen, especially if it is severe. An unexplained lump in your abdomen, especially if it is on your right-hand side. Unexpected weight loss, perhaps due to loss of appetite or feeling bloated or sick. Unexplained tiredness, dizziness, or breathlessness. These can be symptoms of anemia. Please note that most people with these symptoms do not have anything serious, but your GP will certainly want to examine you and may refer you on for further tests. Your bowel management should improve with time if you follow this advice and do regular exercises. If you have any questions relating to your bowel movements or need further advice or support, then please do not hesitate to request an appointment with a qualified physiotherapist.